and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communication Service, and Multicultural New South Wales. Thank you for joining us. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and I am your moderator today. And we have with us, as always, Dr. Jan Fizzell, the Senior Medical Advisor of New South Wales Health. How are you, Dr. Jan?
I'm well, thanks, Jess.
Good to see you with us today.
Yes, nice to be back.
And before we start, we'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders past and present, and also emerging, and pay respects to Aboriginal colleagues. We also would like to acknowledge the elders and leaders from multicultural communities represented in this forum today. As always, we have 30 minutes. We have 30 minutes to answer your questions and for you to give your comments on the chat. Please keep your microphones on mute, and we thank you for all the lively discussion that we'll have today. For now, we'll start with the main question. Dr. Jan, COVID-19, how is the situation now in New South Wales Health? New South Wales across the state?
It's still definitely very much with us. So I think most of us who've got friends who've got children at school or colleagues will know that somebody's sick in their general circle of friends at the moment. So we've certainly got COVID around with us in New South Wales. We've had some changes to testing, though, which came in on the weekend, or coming in this coming weekend, where the PCR testing that everyone's been able to access without a referral from their doctor will now become referral only. A lot of people in the community will have noticed that the centres that they've been driving through have been generally closing up. And that's because we've got a lot of availability of rapid antigen tests through the community. You can still pick them up at Service New South Wales centres, a lot of health facilities, a lot of community facilities. So there's definitely a lot of rapid antigen tests freely available in the community. But if you are a person who's at higher risk of having COVID-19, PCR tests can still pick things up a little bit earlier than those rapid antigen tests. So what we'd recommend you do is have an arrangement with your doctor about where you could go to get a PCR test, when to get a PCR test, so that if you do need to have that test done, you've got that referral from your GP ready to go to one of those testing centres. At the same time, though, again, if you're in a rural location, somewhere where, or it's Saturday when you get symptoms, don't wait till that PCR test is available. Do that rapid antigen test. So everyone should keep those tests still at home because they're still very useful.
But we should be checking their expiration dates as well.
Oh, absolutely, because we know some of them are starting to get towards their expiry date. So if you did put in a big stash at the beginning of 2022, do have a look at those expiry dates, because the last thing you want is a misread because you're using an old test that's out of date.
Thank you, Dr. Jan. And we have our colleagues from the Multicultural Health Communication Service putting some key links on the chat. So please give us please use those links and use those resources. And we have, as always, we've got a lot online. Dr. Jan, the question is, in terms of the rapid antigen test, you said that PCR can detect us earlier than possible, but the rapid antigen tests, how should we be storing them and how should we be using them, especially with Sunday coming up for Mother's Day as well, celebrations?
So one of the things that we should be doing is, one, have a look at the box. The box will tell you how you should store them. They tend to not like getting too hot, not such a problem right at the moment, but trying to keep them in a stable environment. So I keep them in a cool, dark place in our house so that they tend not to get too hot, not too cold. The key thing is to make sure that you follow the instructions. Sometimes the instructions are slightly different between different tests. So make sure that you particularly wait the length of time that it tells you to wait when you read the result. The key thing is, though, they're really useful. So, if anyone's got a sniffle, even if it's just a really mild sniffle, that can be COVID. So it's worthwhile before we get together for Mother's Day, because a lot of us have got older mums and we want to keep them safe. So if anyone in the family's been around anyone that's got COVID, if they've got symptoms, it's worthwhile having a test before you all get together as a family group to try and make sure that we don't take COVID with us when we're celebrating together. Particularly if you're going into an aged care facility or if you're taking mum out of an aged care facility, please be particularly mindful about having people tested before they get in touch with mum so that we don't take COVID back into aged care. We did see a little few outbreaks after we see these major holidays in aged care facilities, because people, thank goodness, can now get their families together. But one of the ways we can prevent that is by having people tested, or even if you're not positive for COVID, flu is bad for older people, RSV is bad for older people. So even if you're not positive for COVID, no matter how much your mum wants to see you that day, please keep away from mum, keep your symptoms to yourself, and celebrate on a different day.
And maybe do it online.
Yep. And it can be Mother's Day every day, honestly. So, pick another day and celebrate mum that day.
Yes. And Dr. Jan, in terms of COVID and being around, and as you said, the flu and RSV, the masks, usage of masks, how do you recommend that? Because we see a lot of people now using the mask, and I think that's appropriate.
Look, it's around and about again at the moment. So I'm generally still wearing a mask when I go into the shops. It's becoming more difficult to remember sometimes, I think. I've recently had COVID, so the chances I'm going to get it again very quickly are low. But I tend to wear it in a place where I'd hope other people would wear it too, just because, again, the more we normalise that sort of behaviour, the easier it is for other people to feel like they've got permission to do it. So public transport, definitely I'd be wearing a mask at the moment. If you're going to the shops, or if you're going into any indoor crowded environment where, particularly if you're going to move around a lot and see lots of different people very, very quickly. I know it's really hard, and a lot of us are just getting out and seeing people again in large groups for the first time. But, COVID can come with us when we go to those activities. And so just being really mindful about not going to those types of events or leaving the house if you're unwell.
Yeah. And Dr. Jan, thank you so much. And please ask your questions, put your comments on the chat, and we'll try to get Dr. Jan to answer those questions. Now, winter is here. I mean, I feel it. It's really cold. Yep. And it's fast approaching, but it's not entirely here. But what flu is about, COVID has the same symptoms.
Look, and I think this is the thing, that we know that flu is going to start picking up, but we have got flu vaccinations readily available throughout New South Wales. And flu vaccines, not 100%, 70% protection against the flu, but 70% is better than nothing. We know that people of any age and any fitness can particularly become unwell with flu. We do see, 19-year-olds who are well playing sport in ICU. So it's not like you have to be particularly unwell. However, there are people who are at higher risk of getting the flu, and those people are able not just to access a flu shot, but actually to get a flu shot that is being provided free of charge. There may be an administration fee from some GPs or pharmacists, but the vaccine itself is free of charge. And they are children aged 6 months to under 5 years, people aged 65 and over, Aboriginal people from 6 months of age, pregnant women, and other people with serious health conditions. So diabetes, cancer, immune suppression, obesity, which is a risk factor for flu, severe asthma, kidney, heart, lung disease. Please talk to your GP and do get that flu shot, because, again, influenza is a really serious illness. For some people, it's really mild, but for those people where it's a serious illness, it's, not nice at all. It's an ICU illness, and it can be one where we have to put people on heart-lung bypass to try and get their lungs, their body oxygenated. So really serious illness, and really important we take it seriously.
And we want to make sure that the emergency departments are also, clear. And
that's the thing. The more that we prevent illness from spreading, the easier it is for anyone who needs emergency departments for other reasons to get that urgent care. Our emergency departments can get really, really busy. It's still important that if you have an emergency that you do go and get care. But if there are things that we can do to prevent, GPs having us, emergency departments having us by, staying healthy, staying home if we're sick so we're not spreading it around, getting our immunisations so that we can try and prevent illness, and having a plan for what happens when we do get sick. And that could mean that, if you live by yourself, having, some sort of social network to try and work with to get food dropped off to you and so on. I know that's not easy for everyone. And for some people, that's really impractical. So that means if you are leaving the house, then to make sure you wear a mask so that you're less likely to make other people sick.
Yes. And like you said, if you can't access your GP, you can go to the pharmacist.
That's right. The pharmacist can give you, but also if you ring the Health Direct number, and I'm sure we can put that Health Direct number up in the chat, we're still able to help connect you through to the level of care that you need. So if you need an ambulance, Health Direct can help you with that. If you need a GP to talk to, particularly because, say you're immunosuppressed and you might need medicine to help you if you have got a flu or COVID, then Health Direct can help give you advice about what you need to do right now. They can give you advice about kids. They can try and line you up with a children's emergency doctor if you don't need to go to emergency yourself and you're not sure, because I know it's really hard when you've got a kid and they're not looking great and you're not quite sure what to do at 1 o'clock in the morning. Ringing that number can give you some real reassurance. So that Health Direct number, which is also available, I understand, you can access that number with a number of languages through translation.
Yes, and you can call TIS on 131450 and ask for Health Direct. And there are language support. Even pharmacists, they can ask for language support.
Exactly. So that's the really important thing, is no one should feel that they can't get help. There is lots of help out there. And if you're unsure which level of help you need, ringing that TIS to put in touch with somebody in your language to help you talk to Health Direct to find that right level of support is a really important intervention.
Yes, and as you've seen in the chat, the 24-hour health advice you can count on is 1-800-022-222, and you can call TIS 131450 and ask for a Health Direct line for urgent care. And again, you were saying that this is not if you needed advice immediately, where you don't know if you needed to go to the emergency or you needed to go to the GP.
Exactly. And I think that's a really common situation. You're not quite sure. And particularly, I think now that it's cold, people don't want to go out. And people have heard that emergency departments are busy. But the last thing we want is somebody who needs to go to emergency hesitating and not going to the care that they need. But at the same time, if you don't need to make that trip out that night, then having that ability to call this number and get good medical advice from trained health professionals is a really big difference for you.
Thank you, Dr. Jan. Now there's influenza. That's the same thing, isn't it? But it's serious. People shouldn't take it lightly.
No. So, I mean, one of the things is people say, oh, when you've got the flu because you've got a cough, you've got the high fevers. Not everyone with the flu gets all of those symptoms, but the flu does tend to knock you around a lot. Same with COVID, not everybody, but for some people, COVID can knock you around quite a bit. And so avoiding these illnesses, because for some people, it may not have avoided a trip to hospital, but it may have meant that instead of 5 days off work, you lose 2 days off work. So it can make a big difference to your income as well, if you've been able to take those steps to prevent those illnesses occurring. And that's why a lot of workplaces offer immunisation, not just because it's for the good of their workforce, but it also keeps their workforce being able to come to work.
Yes. And again, you can have the flu shot and the COVID shot
on the same day. So if you're due for a booster, so if you're over 50 and you've got illnesses and you've had a discussion, definitely you should be getting a COVID shot. If you're over 65, definitely you should be having a booster if you haven't had COVID in the last 6 months or you haven't had a booster in the last 6 months. If you're aged over 18 and you've got chronic illnesses, do talk to your doctor about whether the COVID shot is right for you. And again, for people over the age of 18, they may also choose to have a COVID immunisation, particularly if they've got someone in their household who, is immunosuppressed, particularly vulnerable, because, we do see that there is, less transmission in households that are highly vaccinated. It doesn't mean that in a whole vaccinated household, it happens every time, but we do see fewer people getting sick, and certainly people's illness duration is less, which means that they're infectious for a shorter period of time.
And Dr. Jan, there are still a lot of people who may feel hesitant to take the vaccine. What is your recommendation for family members in discussing this issue with them?
I think the other thing that we often hear is, I've had my 3 shots. I really don't think I need any more. So, or I've had COVID and I've had my 3 shots. I don't need any more. What we know is, particularly as we get older, or if we've got problems with our immune system, that immunity can wane over time. Yes, it's still there. There's still some protection, but we can get back up to like a 94% protection against very serious illness and death if we've had a booster within the last 6 months. And so that's why we're sort of saying to people that if you haven't had a booster this year, and you haven't had COVID this year, now that we're getting to May, then it's probably time to think about getting that booster so that, you don't wind up in hospital, so that you don't wind up having problems. So it's certainly worthwhile doing. So it's not a matter of I've had my 3 shots, it's all over and done with, I never want to talk about it again, particularly if you've got people with chronic illnesses, people with cancer, people with heart disease. It is certainly worthwhile having those boosters.
Dr. Jan, some people have had COVID more than once.
Exactly. And even if you've had COVID more than once, if it's been more than 6 months since you had COVID, more than 6 months since you last had a booster, it's still worthwhile having a booster if you're in one of those higher risk groups.
And also protecting yourself for those people who may not be vaccinated.
Look, I think that's it. We all have somebody in our, circle of friends, circle of family who have chosen not to be vaccinated for whatever reasons, or who may not have been able to be vaccinated. And us being vaccinated, it's not a 100% guarantee that we won't pass COVID on to someone, but it does reduce the risk somewhat.
Thank you, Dr. Jan. And please put in your questions on the chat and we'll get them answered for you. Monkeypox is also an issue that's coming up. I mean, we've talked about it in the past, but there's some cases or a case that might be important for us to think about.
Well, we had our first case since November 2022. So it's a huge shout out to the public health community and the community themselves who went and got vaccinated and who've been careful about mpox transmission, to have not had a case for a number of months, but it does still tell us that mpox is still out there. So it's our first case since November 2022. And so it's really important that gay, bisexual, and men who have sex with men do keep an eye out for those symptoms, because they could still occur. They can incur, small pimple-like lesions, which can spread and develop pus and crusts over the pus and crusts. Some people have a bit of a fever, a little bit unwell generally, could have headache, fatigue, and their lymph nodes. So, you often have your doctor feeling your neck to see if your lymph nodes are up. Those lymph nodes can get a bit swollen, and it can spread to others. So it's really important that if you've got any active lesions that, you're staying away from other people. If you think you have got it, do see your GP or a sexual health clinic. Sexual health clinics, of course, are free of charge and available to people to make sure that your diagnosis could be confirmed. And again, if you are a person who's at higher risk, it is worthwhile making sure that if you've been thinking about getting the vaccine, those vaccines are still available. So please do get vaccinated. You can check out on the New South Wales Health website whether you're one of those people that it's recommended that you get that vaccine. So please do have a look at the New South Wales Health website. It's got lots of information about mpox and also who should get vaccinated and where to get vaccinated.
Dr. Jan, if you've had monkeypox already and you've been healed and it's gone, can you get it again?
Look, this particular strain of mpox is still new, but we would think that there's good protection against getting it in the future. We know that with these types of viruses, so it's in the same sort of family as the smallpox virus, which we got rid of a number of decades ago now, thank goodness, that, infection with one of those viruses does tend to protect you across a larger range of those viruses. So it's unlikely that you get it again. But if you've had it and you get those symptoms again, getting checked is not a bad idea anyway.
And also with physical sickness, there's also that mental health well-being that needs to be taken care of.
Look, I think this is the thing that people with mpox have sometimes, or people who are at risk of mpox, they're often people who are shunned by society. They may have had troubles with their family. They may now have a new chosen family. It's really important that we look out for people and make sure that people feel supported and cared for.
Yes, and for people from multicultural background, people from culturally and linguistically diverse backgrounds who want to talk to people who are who come from their culture, speak the language, there is a transcultural mental health line.
And that's really important, because I think it doesn't matter whether we're talking about mpox, it doesn't matter if we're talking about COVID, it doesn't matter if we're talking about just having a really rough time, because we know that, the cost of living's gone up. There's a lot of stress on people at the moment. So that transcultural mental health line that's now available. They'll put the link in the chat. Really important resource for people who may just be struggling with their mental health at the moment.
So, Dr. Jan, being the senior medical advisor, it can be as well. It's stressful to also see all these new information about health and that you get it firsthand. How do you handle it?
Look, I'm lucky. I've got a good family support, so I can talk to my family about it. I have work colleagues. I talk to my work colleagues about how I'm feeling. And, a few years ago when I was suffering from depression, I was reaching out to my GP, and my GP was making sure I was looked after. So I think for a lot of us, it's one of those things that can happen, and it's about being aware in yourself about how you're going, how you're feeling. It's about being able to step back sometimes and switch off. So I've had to do that at times in the last couple of years where things have got really overwhelming, whether it's because of family issues or whether it's because of work issues or work and family issues all at the same time. Sometimes you just have to step back, make the world a little bit smaller with people who are wrapping around you and supporting you. And then as you feel stronger, to go back and start approaching the world again. But getting that professional support when you need it is really, really important, and listening to people around you. Because I think one of the things that happened to me, I had postpartum depression. So after I had my son, I was not very good at recognizing that I actually was not great. And so having people say to me, stop, you need help, was actually really important, because you needed to have people, I needed to be able to listen to them and saying, no, you're not actually all right. And listening when somebody says you're not okay. It's one thing to ask people, are you okay? It's another thing to also listen when they say, I'm worried about you. Even if it means you go to the GP, you blurt it all out what they're telling you, and the GP says, no, actually, you're fine. You've just got a stressful life. You're coping all right. That's a really helpful reinforcement that you are okay. But if you're not, the GP may actually also say, you shouldn't be feeling like that. These are symptoms that we need to look after. And, your GP can also help lead you into care.
That's right. Thank you, Dr. Jan, for that. And there's a question from Rhonda Katan from our Council, Australia. And she said, Dr. Fizzell, back to PCR. Can you please remind us, please, when the hubs will be paced out? And that is?
So Saturday, the 13th of May, I'm having one of my days where I'm not quite sure which week it is in May, because it's been a very busy May so far, but I believe that's this coming Saturday. And so in which case, those PCR hubs, there'll still be clinics that will do PCR testing, and there'll be testing clinics. Most of the private laboratory services will have certain clinics which will still take PCR tests. And of course, your GP, if they're willing to, can also do a PCR test on you. And certainly some of our hospitals will still be doing PCR tests for people being admitted to hospital for certain reasons. But generally speaking, talk to your GP about what's available in your local area and where the testing centre they would suggest that you go to is, if you're at higher risk. But for the rest of us, those rapid antigen tests, particularly if you use it more than once. So I know that in my family, when people have come down with COVID, often when they first get a tinge of not feeling great, the test is negative, but by 12 hours later or so, that test has gone strongly positive. So if you're not feeling great, those tests often work better when you sort of use them, not just once and say, it's all good. Once, and then maybe 12 hours later, if you're still not feeling a lot better, and again, you'll have made enough virus for those tests to go positive if it's COVID. If you've got really good going symptoms and the first test is negative and then another test a few hours later is negative, you probably haven't got COVID, but you'd be surprised how often people find that second test has gone positive.
And I think that's good advice, Dr. Jan. What you're saying is, if you did see a negative, but then you still feel unwell, be vigilant and try doing it again.
Exactly. Do it, particularly if you're a high risk person. So if you're a higher risk person, I managed to get COVID just before the public holidays. So there were no PCR tests really easily available to me. But I knew that by having one test and then another test and then another test, because I was, didn't really want to believe I got COVID. It was pretty obvious that was what was going on with me. And that meant that I had to put the plan in action, because I think people know that I have an immunosuppressed because I have an autoimmune condition. And, it meant that I had to put that plan in place pretty quickly, because the chemists weren't going to be open the next day.
Oh, antivirals, you were able to access
That's
that.
right. So it's really important that if you don't have a plan already and you do get sick, that Health Direct number, and particularly ringing TIS to put you in touch with Health Direct, can help get you in touch with a doctor that can prescribe you those antivirals, particularly if you're immunosuppressed or over 65. So if you're immunosuppressed, so usually that's people who've had recent cancer treatment, or people like me who've got autoimmune diseases like rheumatoid arthritis or Crohn's disease, who are on strong medicines to stop their immune system basically trying to eat them from the inside out. It means that we may not respond as well to the COVID. And so having those medications can actually help get rid of those symptoms pretty quickly.
So again, have a plan or know where to call.
Or know where to call. So the best thing to do is to talk to your GP when you're seeing them for your flu shot and your COVID booster, and have that plan. If I do get sick, what should I do? And if you, for whatever reason, it hasn't happened already because you're waiting till next week to see the GP and you happen to get sick on the weekend, that Health Direct number can help get you in touch with somebody.
But also, Dr. Jan, a lot of people may also be feeling like, what happens now, who are dependent on the PCR test?
Look, I think the key thing is that we've never had a test quite so available as the COVID rapid antigen test. So, for example, I can't go out and buy flu tests nearly as easily as I could buy a COVID test. So I think we should have some reassurance, and particularly because the large number of free tests that have become available. I know that they're, in lots of different places. And so don't just go, oh, what would I need that for? Just pick up a couple, because that means that if you're an immunosuppressed person, you can do what I suggest, instead of going, oh, there goes $5, there goes the next $5, you've actually got them available to you.
Thank you, Dr. Jan. And there is a comment from Rhonda, and a question: can I alert people to our website, because there's a good tool to making a plan, and is it available in English or Arabic for making a plan when you have COVID? There are some resources in language in terms of getting the antivirals, and also we'll get back to you, Rhonda, and the communities in terms of providing language information or information in language for other alerts that we have. Dr. Jan, in terms of celebrating Mother's Day, for a lot of families, they would be celebrating Mother's, and there are other upcoming celebrations. We know it's coming in June, July holidays for kids. What suggestion do you have for people not to take care of themselves, and noting that winter is almost here, even though I can feel it is?
Look, I think for a lot of people, Mother's Day is actually a really hard day. There are people who would have liked to have been mothers who aren't mothers, and people who've recently lost their mothers. So it can be a really hard day, and being aware that it's okay not to feel okay, and to reach out to resources like the Transcultural Mental Health Line. And there's lots of other health lines out there like Beyond Blue and so on. So if you are not feeling good, make sure that you do take care of that. If you're missing someone away and you're away, or you're working, or you wish you could have been at an event but you couldn't be in an event, do use, we've learned a lot about technology, haven't we? All know how to FaceTime and so on. Particularly if you've got an older person in your life who'd like to be reaching out to friends and family overseas, do try and help them with the technology, because I know it can be really, really frustrating at times trying to help an older person, or even a person of my age, with technology. Help the older people, make contact with people, because it'll mean a lot to them. And I know that particularly grandchildren, sometimes there's a language barrier between grandchildren and grandparents. So making that extra effort to try and help grandparents. And it's really interesting with some of the things that we've got available to us today to help us communicate with each other. We just need to use as many of those different good technologies as we can to try and keep people connected.
That's right. And thank you so much for joining us today, because that's what we're here for, to keep everyone connected. Dr. Jan, any last messages for the media that's online today? And I particularly really connect with that message of, although it's Mother's Day, that doesn't mean that there are a lot of other people who it may be difficult for them celebrating this time. And in all occasions, I think that's the best advice.
I think it's really important that, when we're busy celebrating and busy being happy, and my goodness, don't we need to celebrate and be happy as often as we can? We do need to keep looking for the people who might be missing or who may not be as privileged to be in that happy situation as we are, and make sure that we're providing care and connectedness with them. I think that's super important for all of our health.
Thank you, Dr. Jan. And thank you again for joining us. If there are other topics or other information that you'd like for us to provide for you, please let us know. We'll be back in another fortnight, and we'll make sure that we have resources sent to you that's available in language. We want to thank you also for ensuring that you are able to deliver these resources and information to your communities. So we'll see you again next time. Meantime, have a good rest of the day and stay safe.